neurofeedback is essentially exercise for the brain. The more often you train it, that's why we call them training sessions, guess what? The better you'll be. Anything you train on, well, you become an expert at it, at some point. So same thing, like with post-stroke, concussions, traumatic brain injuries, autism. I mean, I've had people ask, well, what kind of results can we expect from certain conditions? I say every brain is different. I can't sit here and guarantee that your nonverbal child is going to start speaking. I can't say that. However, I have had patients who, like the stems that they were having. I had this one patient who had like 20 stems, like a day.
Hello, everyone, and welcome back to another episode of Wellness at the Speed of Light podcast. I'm your host, Dr. Stefano Senecropi, and I am extremely excited today to welcome Dr. Candace Holmes to the program. I was talking to her a little bit about, before we started the show. She is the first chiropractor to appear on Wellness at the Speed of Light podcast. And for those of you that follow me, you know how pro chiropractor I am and how much I use them within my own practice. Of course, we use the ones that we like and are doing it the way, but that's no different than the way we use any physician, right? The ones that we feel like are doing the best job. And I've had nothing but excellent relationships and results from the chiropractors that I use here in Minnesota. So welcome, Dr. Holmes. It's such a pleasure to have you on the show.
Thank you so much for having me, Dr. S. I appreciate it.
Well, good. Let's dive right in. Since you happen to be the first chiropractor, we've had exercise physiologists, all kinds of PhDs, MDs, DOs, all kinds of stuff. Because you're a chiropractor, I want to really help our audience understand what chiropractic medicine is. Because if I just pull somebody off the street and say, what's chiropractic medicine? And say, crack your back. That's all they say. They don't really understand the full scope of what chiropractic medicine is. And that might go for a lot of my colleagues too. They don't really know what it is because they don't use chiropractors that they've heard, not the greatest things. And most of that is it doesn't make sense. It's more of a not knowing. What is chiropractic medicine?
Well, the first thing I always tell people is please do not associate crack with a chiropractor ever. It's definitely not my name. So most people think that all chiropractors do is, like you say, crack bones and make this popping noise. What they don't understand is that we focus on the nervous system. The nervous system just happens to be surrounded by the spinal column. The nervous system is what controls everything. So when your nervous system is functioning well and all the synapses are firing and the impulses are going from your brain to the rest of your body, all is well. There's no pain. All your systems are functioning optimally. It's a great thing. So when there are misalignments, that's when we go in and make the adjustments. So we don't call it popping or cracking. However, we will use the quotes because that's what most people hear and recognize. But I tell people it's just the same with medical doctors. The body's the same. So the first 2 years of school is the same. We learn about the body the last 2 years. We learn about health and wellness the last other 2 years. For the medical doctors, you all go into your specialties and you learn more about medications. That's it. It's the only difference.
That's great. So tell me more. You just brought up a good point. So in your first 2 years, you do 2 years of basic sciences. You also do gross anatomy.
Gross anatomy, absolutely. And we have anatomy classes typically than the average medical doctor. One of my good friends is a medical doctor, and she's like, "Oh, you all take x-rays?" Yes, we take x-rays and we analyze them. Most medical doctors don't do that. That's what a radiologist does. So the body's the same. Again, it functions well. Once you know how it functions, then, you go more into your specialty. It's just how chiropractic is. It's the same thing as, medical school chiropractic is for the first 2 years. And again, like I said, the last 2 are just where the changes occur, the differences.
So after you do your basic science, then is it similar to med school where you do different rotations in different facets? Like you do, I see a lot of chiropractic medicine that deals more with kind of cervical cranial junction, for example, that kind of stuff. Is that what you do? You spend 2 months at a time rotating from kind of specialty to specialty within chiropractic care?
Sure. It's not necessarily for a finite amount of time, but there are over 100 different chiropractic techniques. And so there are basic ones that most schools teach, and then there are the ones that may just focus on upper cervical. There may be ones that focus on the extremities, say if you want to be a sports chiropractor. So it depends on what the particular doctor would like to do. It's like I say, I don't know all the techniques, but the ones that I know well, and so just like in anything, we take a little bit of here, we take a little bit of there because, it's very personalized personalized and individualized. You may see one chiropractor, you may see me today, and then another chiropractor tomorrow, and we'll do 2, totally 3, 4, 5 different techniques. And they all work. They all work.
So, you bring up a couple points about techniques, because this is a question I do get asked a lot, and maybe I have had really good dialogue over the years with the Minnesota Chiropractic Association. I feel like they do a really good job. I don't know how other chiropractic associations do, and how other states kind of handle this. We all have associations, we have like North American Spot, we have all kinds of associations. Then we have our own medical things like Minnesota Medical Association, things like that. So no different with chiropractic care. But one of the questions I get, and some of the skepticism that goes around, chiropractic care, is the fact that there are so many different techniques. And you made a good point, right? In medicine, how many different specialties are in there? And then there's subspecialties within, it goes on, for a long time. But just going back to that, it's very, what I'd like to know, how do you standardize? Are there certain things that you need, like that absolutely every chiropractor needs to do in a standard way? Are there like 10 things and then everything else is like extra training or going down that? Or how does it really work? How do you standardize chiropractic care? How do we all speak the chiro lingo, so to speak, so that we know what you're doing? So if you work on a patient versus another chiro and I see the notes, how do I know what's standard, what's outside? I just, that's, no different than the questions they asked up to us. So what's the difference between a orthospine surgeon and a neurospine surgeon?
Exactly.
The truth is there's not much, but go ahead.
Right. Well, and that's it. So typically when a patient walks into a chiropractic office, they have a consultation. Then we go into an exam, which typically includes some orthopedic and neurological testing, because guess what? If you're not a candidate chiropractic, we're not going to adjust you. We are going to refer you out to those specific specialized doctors, that are warranted based upon our findings. And then as far as the techniques, there is a baseline that we use for analysis before we even go into the technique. So that's the difference. There is a standard. Some chiropractors take x-rays, some refer out to take x-rays. I mean, back when I first started practicing, x-rays was just, that was the whole thing. We'd rather take it at the hospitals because they can afford those, $1 million machines that, can get through all that tissue. And now they're digital, which is wonderful. But there are some techniques doctors that don't take x-rays because the techniques are so gentle. There's no need for it. So it varies.
That
like
makes
my
sense.
daughters, I'm typically a traditional chiropractor in the fact that I use my hands to adjust. And I also use a table. The table, our tables can do some magnificent things.
Yes.
And I won't say I made the mistake. However, I took my daughters to one of my colleagues and she uses an instrument and they preferred the instrument over me. I said, you don't realize how gifted these hands are. I said, you have no idea. However, I said, okay, if that's what you like, then we'll go with it. You don't force anyone. And that's another point too. Most people only get themselves adjusted. And I said, do you have children? And they said, yes. I said, well, where are they? Oh, I didn't know children get adjusted. Children get adjusted. Infants get adjusted. I've adjusted my children when they were 8 and 3 hours old. I remember I was covering another doctor's office while she was on maternity leave. And a person came in, and mother came in. She had just had her daughter 2 days prior. And she's like, there you go. I was like, oh, like typically, like I thought she would want to know me. Nope, doctor such and such trusts you, so I know you know what you're doing. And I was like, okay, here we go. And the adjustments that an infant gets are different from those that a child gets, are different from those that a teenager gets, from a middle-aged person, from a senior citizen. I don't make the same adjustment. Everyone gets a different adjustment. It's based on what your body needs and the state that your body is and at that time.
Well, for full disclosure, like we said before, my entire family, both of my kids have been getting adjusted since they were little, and it's always been a go-to, for our kids, because generally in our household, even though, I'm an allopathically, trained Western, hardcore doc, we've always had some, contact with holistic care. I don't know if I want to put chiro under holistic care because it's so common, but we've done it for a long time. But it's interesting because I myself, even though we were using it for our own family members, even up to the time I started as a practicing physician, it wasn't until when I started practicing, there was a doctor of osteopathy and they do adjustments in their world. And I learned so much from this doctor here in Minnesota. His name is Dr. Mann, and he was so pro adjustment, and it really made me think. Really learned so much about sacroiliac joint adjustments.
Yes.
I actually had my own. I had injured my sacroiliac joint, and he did this crazy adjustment where he put me over the table, and the pop was so loud in the room when he did. I was in pain. I walked out with nothing. I was perfect. One manipulation. So this is a DO and physician, right? He's a physician, so different schooling. But seeing that made me so comfortable referring to chiros. Then I myself started reaching out to local chiropractors that I could refer to. And it ended up being a great relationship. And I do have tremendous faith and trust, like you said, that chiropractors, okay, not everybody, just like not all physicians are going to do what needs
not
to be
all
done.
Everybody. Exactly.
Not all the lawyers, but accountants, everybody. People do what
Everybody.
they're going to do. We don't have to. Let's not get into ethical discussions. But the chiropractors that I do work with have been extremely and if they see anything that is out of the order, they either call, send a note, or just send the patient. They just say, I'm not comfortable, or I'm not comfortable until you get an MRI because you've got a little weakness or you have severe radiculopathy or whatever. I'm not going to touch you.
Absolutely.
And you know, and that's great. And that is the trust that, from my opinion, needs to just develop between all of the different specialties, whether or not. Now, there's different things, you know, acupuncturists, and actually, a lot of chiropractic offices do acupuncture. I'm a big fan of acupuncture. I've been, you know, that has been, for whatever reason, in Minnesota, acupuncture was accepted even 20 years ago when I started. There was a couple of there was a hospital in a couple places, but there was specifically a hospital that I used to work at. They had an acupuncture center, because they're one of the best. They have this tremendous OB-GYN program. Both of my kids were born there, and they just happen to have an acupuncture center. So I would always send my patients there with good results. Now, again, people can quote some studies, like, you know, some sham studies that they did where people got it. We all have to understand, if we really dissect medications, right? There's a lot of placebo too with just the hardcore medications, but you know what? A lot less side effects with some of the things we're talking about right now. But just going back to that, have you seen a difference between how MDs and DOs accept kind of what you do? And do you feel like DOs are much more chiropractic friendly? Because they certainly are here in our town.
Absolutely. DOs are the only difference between DOs and DCs and how we adjust is DOs, what we call a long axis traction. So they may take a leg and go, you know, over here, where we specifically try to find, you know, which areas have to be moved at that particular moment. So yes, very much friendlier, excuse me, with the DOs than with the MDs. The old school.
Yeah.
The classic. I don't know how do I say that? Those in my generation and younger are coming around. So I'm excited about that, just because we do much better when we work together. You know, there's room for everyone. So I remember when I first went to chiropractic school, I didn't see any offices, and I see them all the time. And so I see chiropractic offices all over. I said, yes, because there is no one place where we all gather, as opposed all the MDs are in the hospital or they're in the medical center, you know, so it looks like we're everywhere, but we're still taking care of, I think it's less than 20% of the population. So yes, it's a lot we have a lot more movement to do, but it is getting better. So I'm thankful.
Yeah, so I think that what I've always appreciated about DOs and about chiropractic medicine, you know, doctors of chiropractic, is the open-mindedness for other techniques. So just to give you an example, you know, in our wellness centers here in Minnesota, and I've gotten like deep into photobiomodulation, laser therapies, these other things that we do, and I use them for my patients with like incredible results. But when I go out and I speak about these different techniques that we're using to chiropractors or DOs, and my partner, our medical directors are DO, like completely open to, oh, that's interesting. Love to hear about it. When I speak to my MD colleagues, I am speaking now, because I have developed a much bigger presence now on social media and people know me and what I'm talking about. I am getting a lot more buy-in. But when I first started this and I would go out and talk to MDs about anything that we didn't get taught in medical school, I mean, it is talking a different language, skepticism. And the biggest thing was, when I first started getting into this a couple of years ago, the first thing is like, why would you even waste your time with that stuff? Like, you're like a real doctor, right? Why would you do that stuff? I said, because we can't do what we're doing right now. Number one, there's a lot of risks that people are taking with medications and surgeries and stuff. And yes, they have their place, they're indicated. Obviously, I'm still a hardcore MD, and I get that millions of lives are saved, but also with overuse of medications and things we're dealing with pharma and all the things, how many lives have been ruined? Let's be honest. I mean, it's just true. I mean, I have patients that just to give you example, people will come in and they'll just say, "Hey, I started on this cholesterol medicine." Okay.
Mhm.
And in my opinion, now as a kind of even though I'm a spine surgeon on one hand, I'm also a holistic wellness doctor on the other hand. And they come in and they just look at me and they're like, "Doc," and they're there just for their spine stuff. And they just look and they're like, "After I started this particular medicine, it literally ruined my life." And there wasn't necessarily a ton of workup. Like, why are you putting them on cholesterol? What's the root cause? What can we do about it? It's just a reflexive behavior. So anyway, but the point of what I was saying before I go on tangents is that we have to keep an open mind. So it's so much easier, talking now on my podcast. I bring on a lot of MDs that are very open-minded and they're doing these great like things out of the box. But I'm just talking about, in general. So thank you. That's good. I'm glad to see that. How about the MDs in Atlanta? Are they a little bit more?
Oh, goodness. Oh,
No.
absolutely. Because listen, the chiropractic school that I went to is here. It's right in Marietta, Georgia,
Yeah.
Life University. And so that's one of the reasons that I moved back. I'm from Detroit originally, it's back to Georgia, because there was a lot less education that had to happen. Like, oh, you're a chiropractor. Okay. What's your specialty? Some of us specialize in pediatric care. Some of us specialize in sports medicine. So everyone has, what their gifts are and what they love to do. So absolutely open-minded, absolutely, because there's more than one way to do everything. There's more than one way.
It's great to hear, and I think we just do need to be open-minded, but we also have to just, even if doctors don't want to use chiropractors or they don't want to use acupuncturists or whatever the thing may be, they should learn about it and understand what is it, because it is our duty as physicians to understand what our patients are getting. It's my job to understand general. I don't have to become an expert in chiropractic, all these things, but I need to know what they're getting so I know how to tailor my approach to what they're doing, as opposed to shutting people off. Because, and this is a message for my colleagues out there, when people come in and they just want you to listen to what they've been doing and what their ideas are, or they want to be holistic, and you cut them off, you might not see them again. You're done, because you've literally not respected their wishes to go a certain direction. We've got to get away from the paternalistic ideas that we have and understand it is a partnership with the patient.
Absolutely.
And patients need to be CEOs of their own healthcare and make those decisions based on the best available information. But doing their own research is critical. And so them watching something like this with, a great chiropractor like yourself talking about these issues is a great way for them to be introduced to this and say, you know what, even though that person told me that chiropractic was maybe danger, I'm going to get into this in a second, because it's real important to dispel some of the stuff that's out here. But when you get misinformation, and this is the one contention I have with my colleagues, and so my job is to figure out what's scientifically vetted, what's not, and then to present information that's based on science. Chiropractic care, a lot of what you guys do, not everything, just like medicine, a lot of medicine is not really, it's not exactly based on science, right? But we have to sift through what it is and then say what it is. But we just can't, shut it off or just say, oh, that's pseudoscience, that's nothing, without even having a clue. No clue. Never read an article, didn't look at randomized controlled studies, all these other things that are available at the tip. And listen, I was hard-headed too, like with the light therapy. Before I learned about it and how many articles and randomized controlled studies and all this stuff, I was a non-believer. I was like, I'm not getting into that, because somebody approached me. I'm like, oh my God, I'm a physician. I can't embarrass myself with these things. And now in retrospect, I'm almost embarrassed, because the evidence behind it is so incredible. It's like, I hope I didn't sound, like, some arrogant guy, saying, oh, that doesn't do anything. But I hear a lot of that. So I'm trying to, cut through the noise. So let's get into the noise on chiropractic care. All right, manipulation. Okay, manipulation. What are the dangers of manipulation, and what are the red flags real red flags that people, and for your chiropractic colleagues, let's say you're speaking and you're speaking, let's say you're speaking at a conference. What are your like top red flags that you would say you should not adjust patients if they have this X?
The first thing we look at is malignancy. So if you have any kind of cancers going on, especially in a particular area, bone cancer, there are some cancers that we will adjust, not that we're trying to, you know, quote unquote cure or anything. It's just trying to mitigate the symptoms to make the person more comfortable. Those who have had strokes, that like we don't adjust the necks. Like we, you know, that I even we have instruments to do that. The upper part of the neck, because that's where the brain stem is the thickest. So we will not in that area. But below it, yes. In the area, no. And again, very light with the instrument. The instrument is controlled. That's what I want to make sure people understand. Because I think when people think about chiropractic, the main vision they have is like, you know, just, I mean, I think I've had so many people, oh, no, doc, don't adjust my neck. I said, the neck is the most important part to get adjusted. I'm trying to tell you, it's the most important part. However, I said, what do you envision? Have you had a bad experience? Oh, no, or yes, you know, sometimes they have. And I said, just think about those karate movies. Like, we're just gonna, you know, I said, we took a vow not to hurt anyone. So that's not going to happen. My ex-husband is deceased now. However, when he was alive, I would say my ex-husband's still alive and I adjust him all the time. You know, I said, so you're going to be okay. So those particular kinds of health issues, and mainly that surgeries and cancer, malignancy, same thing. And then if your structure isn't great. So I remember I cover a lot of doctors' offices too when they go on vacations or things. And a new patient came in and he was telling me how many accidents he had been in. He had a stroke and some other things. I'm like, oh yes, let's go ahead and take some X-rays. And sure enough, I said, see, there's a reason. Like, being in practice, you have a sense about, you know, what you can do, what you can't do. And I was like, I don't like the way this is looking. So the X-rays are helpful. Again, not every chiropractor takes X-rays because, again, they do the thorough examination and they know, you know, where to go and where not to go. So those are the main concerns that we would have. Lots of times people who are smokers, they're typically not the healthiest. Yeah. So I was like, how can I say that nicely? Typically not the healthiest. So these are some contraindications, or not necessarily smoking as a contraindication, but just something to be aware of. And a lot of it is based on the findings, honestly, the objective findings and the clear history that we take from our patients.
So one of the questions that I get actually from providers or things when they're asking me, and I don't really know because it's variable. One of the things we worry about, I'm a spine surgeon, right? So again, we talked about how spine surgeons are skeptical because they're worried about paralysis or nerve injuries and things like that. What I worry about as a spine surgeon, if a patient comes in and they're having like arm or whatever pain, I'll do in our office, we'll do an examination for myelopathy to make sure, even if I don't have a full scan, like if I just had an X-ray. Now, normally I'll always have a 3D image, but every once in a while somebody will come in and they'll say, hey, they're coming for their back, so they'll have an MRI of their back, but they don't have anything for their neck. And the second I pick up some kind of a weakness, or I pick up any type of hyperreflexia, or they can't do a tandem gait, or they have finger escapes, whatever. We go on through the whole myelopathic exam. But do chiropractors typically, if somebody complains of neck pain, especially if they have radicular symptoms too, is there typically a full examination to just make sure they're not myelopathic? Because obviously that can, have, cord compression. And this is the scale. That's one of them. And I'll talk about the next one, next.
Sure. Absolutely. We're taught all of that in chiropractic school. It's I remember the biggest lesson that our professors taught us is it's important to know when to adjust, and more importantly, when not to adjust. So it's like in our exams, like we do a physical, and so I'll listen to the heart, and I have to refer them to a cardiologist. I say, I don't know what it is. I just know it's not within normal. Like something's going on there. I'm not a cardiologist. I'm not going to say you have a heart murmur. I'm not going to say you have a defibrillator. I can't, that's not my scope. So we are taught all the warning signs and all the things, what not to do. So definitely.
Okay. I mean, that's good. I think that's going to allay, a lot of fears more in the medical community, because people don't know. They don't
just
think
walk
like
off
that.
the street, come in and we adjust you and we see you.
But that's the thinking.
Perception.
Now you did like this. Okay. And that's this or something like that. So vertebral artery injury. Okay, that is one where, listen, you find case reports of anything, right? Like
Oh,
we do. I
anything.
mean, our group, we do thousands and thousands of surgery. I mean, every once in a while, there's going to be some crazy thing is going to happen.
Outlier.
That's the way it goes. The people, all kinds of case reports out there. That's why they're case reports. They're few and far between, and stuff can happen. And obviously, I equate it. We talked about like roller coasters before, like roller coasters versus. So you can certainly have a vertebral artery injury with a roller coaster ride, or anything, or just fall. I mean, we see vertebral artery injuries all the time. We're at a level 1 trauma center, so we see that kind of stuff, or motor vehicle accidents and things like that. In your experience, what level of manipulation, like how much force? I don't mean numbers. Because I know it's
Oh, thank you,
quantified
because I don't
stuff.
remember the numbers.
No,
I
no,
was
no,
like,
no,
I
no,
don't
no,
remember.
no. I wasn't going to say that because it's impossible to quantify. People always ask, for somebody have a motor vehicle accident, say, well, how many miles per hour do you have to go to get X? I don't know. That doesn't,
Right.
you can't
No.
even account for all the variables. But there are doctors that do pretty aggressive neck manipulation. What's your thought on that? And what do you think is the risk of listen, with the clicker, the chance of them getting a vertebral artery injury, or the gentle stuff you do, I'm sure that you're going to say it's close to zero. I agree with that. I've never seen one, and I've referred out a lot of people. However, I have very specific chiropractors I work with, so I know what they do.
Sure.
But do you feel like there are some risks with very aggressive cervical, especially upper cervical, manipulation, and what are your thoughts? What are your thoughts on that? I mean, I obviously that's you do it you do it different. You're not doing that, so I don't want you to necessarily
Well,
speak for your colleagues, but
for
it's
sure,
just your
sure.
general thoughts on that for
Sure.
neck pain.
I do manipulations, we call it adjustments in our, semantics, sure. The adjustments that we learn in school, so it's something called the paraphysiological space. So that's the space that our adjustments happen within. When you go outside the paraphysiological space, that's when injuries occur. So sure, you just like you have aggressive, anything, dentist, you can have, it's what most people don't get is that the motion segments are very small. Like I've adjusted NFL players and they've laughed at me. I'm like, why are you laughing? I didn't think you could move me. I said, the bonus is big. Like it's finesse and it's technique.
Yeah.
And unfortunately, just like in any profession, some people have a better feel, a better touch, a better technique, a more finesse than others. And there's a risk everywhere. There's a risk driving a car. So there are some colleagues who have some challenges because they don't know their own strength, and the patients sometimes are hesitant in telling them, hey, doc, just a little less. I've had a colleague when we were in school and he's like, how was that? I was like, okay, next time, just a little lighter. He's like, you got to tell me because I don't know. Because, we don't feel, that's just like, I get compliment all the time on my adjustments. And I said, I wish I could feel what my adjustments feel like.
Yes.
I can't, if I can figure out how to do that, that would be great because everybody, again, all hands are different, techniques are different, speeds are different. When I was in school, I remember, we have student clinic. We adjust on each other. We adjust each other before we are allowed to go into the general population. So again, that's a misnomer too. We don't just start adjusting people without having the experience. And we are very heavily monitored by the doctors who are in practice at that time. So to make sure that we do what we do. But of course, there are risks in everything, and there are some who are overzealous, and it's just part of life.
Yeah, and I mean, and thank you. No, that's absolutely true. I mean, we talk about it all the time with surgeons, right? I mean, not every surgeon is the same. Some people now, some of it is how much you do and stuff like that. But there are major differences between doctors that use their hands to do anything. And so we always talk about hands, like, so I can watch other surgeons working and I can tell if are they really good, or is it like a struggle? Every movement is a struggle because surgery is this beautiful dance of things we do, and it's the same. It's a symphony, right? Exactly. And so that's I mean, I think that's a good analogy. So again, if you look at spine surgery or you look at shoulder surgery or whatever. I'm an orthopedic surgeon. I mean, I only do spine. But if you look at these different things, we always are very worried if we have, for example, a colleague in town that is not doing well or is doing things that clearly are outside of what we need to be doing, because then that hurts everybody else. Because then if somebody is doing something and half the patients are getting injured or something like that, as a surgeon, then that brings a lot of fear in for patients. And so then I'll have a patient in my office that needs surgery literally to prevent paralysis because they're at high risk. They have a severe spinal compression or whatever. They're so afraid because so-and-so had surgery wherever and they had this thing happen. And, sometimes things just happen, but sometimes it always happens to the same people.
Right.
And so,
right.
and I'm sure there's some of that in chiro. So my question is, in medicine, okay, it's a little, not everybody, but for example, in our specialty, where it's more in the it's less than 50 people doing, spine surgery, in this town, it's very easy for people to get crystal clear information and they can ask around. It's a lot different for internists or family medicine because there's so many of them. So I'll ask you that question. As chiropractic, there's a lot of chiropractic because you're general care. You're taking care of everybody, right? From elderly to little kids, right?
Absolutely.
And
Absolutely.
so you're very general. So there needs to be a lot of you because there's a lot of people. And so what are the best resources? Again, not necessarily in Atlanta, but my audience is, nationwide. What are the best resources where people can go if they want to look up Dr. Holmes or Dr. X or whoever in the chiropractic world? Where should people go? Should they go to Angie's List? Should they go to some? I mean, we know where we're there. And I could tell you, people always ask me. I tell you the number one thing, you could go on our reviews, you go to whatever, because obviously everyone self-promotes and whatever. Sure. But I always say, if you really want to know, call the hospitals and the surgery centers where the physicians work and ask the nursing staff, ask those things, ask the lead nurse to say, if you needed spine surgery, who would you have do it? Okay, but that's easy when there's only a handful of people doing these types of surgeries, because then they know. They're like, yeah, doctor, you go to that guy, or don't,
right. Don't go to that one. Right.
But in the chiro where it's a lot bigger, sifting, there's no different. Like I have to, like if I send one of my family members to obviously I have friends, but if they call me from Chattanooga and say, hey, who should I see? I don't know anybody over there. Right. So I have to do my own research, and it's harder. The more generalist, the harder it is because there's so many of them. It's like, I don't know how to sift through the noise. Obviously, you could always find out who the top people are, but there's other people that have really good reputations. I need to know if they're really good. So where do people go if they want to know if this is the chiro that they can trust and it's going to provide good, safe care for them? No different than surgeons. You want to be safe. Number one, you got to be safe. Everything else doesn't matter if you're injured.
Absolutely. A great resource is honestly, it's Google, looking at the reviews. I have a lot of people who know that, I'm a chiropractor. Hey, doc, I'm moving to California. Who can you recommend? So then I'll go on, I'm in Facebook groups. It's like, hey, I have a patient that's moving to this area. Hey, oh yeah, sure. And then, okay. And then we give, like I used to do house calls for chiropractic. And so I would get people in the group, hey, I have a patient moving to Atlanta, doc. Can you search whatever? Honestly, you can ask your friends. They may not tell you that they're going to a chiropractor. Most likely they are, or they know someone who is. And they would say, yes, go to this. Don't, it's so easy now with so much technology and so many resources that we can find. So you ask around, you can go on Facebook. Well, I guess we should say Facebook. Go on social media. Like, I don't know if we say that, but go on social media and ask, because those people will give you their honest experiences and results and truth of what works and what didn't work for them. And again, what works for one person may not work for another. Someone may think my hands are gifted. Someone would think, oh, I don't like her touch. So it varies. It's like I was in high school. I was in a medical careers group when I was in high school, and I would come back to my alma mater, Renaissance. Got to shout them out there, Blue Ribbon School in Detroit, and I would speak to the students there. And my mother went to a chiropractor, and this happened, and she's not not ever going back. And I said, okay, I just left, and I came back. I said, so if your mom went to a dentist and that didn't work out, she never go to a dentist again.
Yeah. Yes.
Like that's it. I said, now, does that make sense? And she was just like, I said, it doesn't make sense. So I mean, just think it through, just with anything. Like not all surgeons cut, some refer like you're not a candidate, so that's a
Yes.
misnomer too. It's not the majority of people who go into professions to help others are there to help others. They're not there to harm anyone. And if it happens, it is absolutely not intentional, not intentional. So, if things happen and they're not the best that it can be, you can find someone else. But yeah, the resources out there. There are there's an International Chiropractic Association. There's an American Chiropractic Association, and they're local to the state. They're international, so everywhere. I mean, chiropractors outside the country have associations as well. So
yeah, I think I love what you said about, they almost every not everybody. I want to give, but almost, I'd say 99% of providers that I've met, they legitimately want to always do the right thing for the people and stuff. Sometimes it's going to happen, but people need to know that. And there are a lot of upset patients when things don't go well. And sometimes because of miscommunication or other things, they feel like, that chiropractor, the doctor, the dentist, whoever doesn't care about them or did something wrong or but they're trying to do their very best. But just because something happened with your aunt, the other things you said, it doesn't mean that no one should ever go get their teeth cleaned again because something happened or somebody got a blood clot when they were sitting in the chair in the dentist's office. Then it's not dangerous. Then it's not like, this is an occupation, it's a hazard of going to the dentist. You have to sit there. And that's how people that they just extrapolate. But the truth is there's so much misinformation now with social media about some of these things. So there's these pro groups on everything, right? And then there's anti groups on everything, and they're like this, and then people can't cut through the noise. And so, that's really what I'm trying to do with this show is just kind of become one of these go-to places where people can go and say, you know what, he's open-minded, he's listening to people that are, that want to tell their story, and then, then let's cut through the noise, from one expert to another or one expert to a patient or whatever, and what's real and what's not, and doing it without any motivations. It's like we're talking, it's not like I'm doing this because I want to, I'm trying to get like 10 free sessions for my, my friends down in Atlanta. And that's I'll say what, no, I really want to get the real, the real story. And so far this has been great because I've really learned a lot because I really haven't had these. And I talk to chiropractors all the time, but a lot of it is about, oh, this patient has an L5S1 spondylolisthesis. How do we work together, to get them better? I have to ask you this right now. You're in Atlanta, right? There's a large African-American population in Atlanta. Atlanta is just an amazing. It's one of my favorite cities. I just don't get down there enough. The last time I was in Atlanta, I was at an Eric Thomas event with my son, actually during the pandemic, and it was amazing. Just an amazing town. But anyway, how do African Americans see chiropractic care different than other people, and again, this is not to say I'm not putting people in a box, but I have a lot of African American patients here in Minnesota, and there is and it is okay. I talk about cultural differences all the time, and it is so important for us as providers, whether you're an MD, a DO, a DC, whatever, we need to understand people's cultural biases. Like, for example, I know a lot of my Hispanic, and they're not all the same. We don't paint a broad brush because, right, my Hispanic patients, depending on what country they come from, right, this is where my New York upbringing, that's where it comes in, because I understand, like, Ecuadorians are not like, they're not exactly like Colombian, and they're not like Brazilian, and they're not like, and then you go in Hispanic, but then there's Puerto Ricans, and there's whatever, and then European people say, oh, they're Hispanic. Well, they're not really Hispanic. They're Spanish. They're from Spain. That's that culture is. That's nothing to do. Like, one thing has nothing to do with another, just because one, whatever. So let's go back to I know on my Hispanic patients, a lot of them culturally have grown up with different things, like, like they'll light candles, for
Yes.
healing, and they
Garlic
they
and
think about it different, so that when I talk to them about some of the things, whereas my African American patients, and again, I don't want to put them all, in the same boat, because it's very different. Like,
very
people,
nuanced.
African Americans, are going to be very different depending on where they come from, what's their background, like how they even grow up. Maybe they were adopted and grew up in an Irish household. I don't know, but I try to figure it out, because
Mhm.
that's how I can counsel them best. And I'm so into the cultural thing, because I can't treat patients correctly if I don't know what they're how they're thinking, because I don't know if they're super skeptical about what I'm telling them, or if they're buying in, or how to
Sure.
go. How do African Americans, especially like in that Atlanta or Detroit, talk about Detroit, whatever, how
Mhm,
do they
mhm.
see chiropractic here? I've never asked this question before.
Okay.
How do they see it?
Well, I used to practice in Ohio. The first state I practiced in was Michigan. And so it was a little different because, again, just the educational component of it. Once anyone's educated on anything, those myths can be dispelled and those misconceptions can be addressed. So that was wonderful. And all my mentors were of color. They're Black. And that's honestly, when I thought about going
Yeah.
to the profession, that's who I went to
Yes.
see. Like, okay, what's going on in the profession? Do you like it? Where would you suggest that I go? Where should I not go? And the reason why that is because historically we've had a lot of negative things happen to us as a people. We are very skeptical about a lot of things going on, especially in regards to health. I've had so many patients that said, I went on Google to find someone who looked like me,
Mhm.
because I know that you're going to treat me like your mother or your grandmother or your grandfather, your aunt, your uncle, your cousin, your son, or your daughter. Just like when I was pregnant with my first child, I went and interviewed all the different pediatricians to see if they understood
Yes.
not vaccinating my child. So am I going to be accepted into your practice or not? Yes, no, it's okay. And no, no, no. And I found one. He just happened to be someone who looked like me. And he was like, yeah, in his opinion, he said the most educated people don't want their children vaccinated, at the beginning. I was like, okay. And I called my husband, like, I found one. He was like, oh, we're done now. We're done, right? I'm like, no, I have one more. Have one more. And so I went to see the next one, and she was totally against it. I'm like, okay, well, not my person. So yes, there is a difference. In Atlanta, like I practice in Ohio as well, and that was a challenge. Just the educational component, and I don't know if it was because I am Black and they didn't, skepticism there, and the whole real doctor kind of thing, and just
Yeah.
what's so interesting to me is I was at a kiosk at a mall. That's where the chiropractor had me, doing blood pressure screenings. And so they were excited, like, oh, okay, where do we go? And it's just like the 2 or 3 exits up. You're all the way over there. I'm like, all the way. I was like 10 or 15 minutes up the street. Like, what are you talking about? I mean, coming from Atlanta, like that's close. Anything that's within 45 minutes is acceptable driving. When you're over 45 minutes to go somewhere, you're like, oh, wait a minute. But I'm like 10 or 15 minutes. I'm like, my gosh, but I remembered I'm not in Atlanta. I'm in Ohio, and so even just regionally, there are differences there. But typically, yes, the Black community has been very skeptical with good reason. We've been tested on and told we're getting one thing, and actually we're getting something else. So to be able to trust your physician is huge in whatever profession. And I personally, when my daughters were, in the pediatric age group, I would take them to a doctor who looked like me. I drove 45 minutes so that they see someone of color, because they need to know that this is something that they can aspire to, and that I knew that she was going to look at me and say, hey, okay, doc, what's going on, and you're doing this and this. Okay, maybe not that, because everybody has their opinions and ways of doing things, and I just knew that there was going to be an understanding. Lots of times, only thing that patients want to be is to be seen, heard, and understood. And a lot of times, people who don't look like you will sometimes brush you away. And even those who do, I mean, very, very, very rarely have I seen someone brush me off, because there's an understanding. You're going to listen, and you may not agree with what I say. However, you're going to give me the respect enough to hear me out. And then you can say what you need to say. And if we agree, we agree. If we don't, we don't. And that's okay. So when it comes to health, it's important to have that relationship with your people, and that's with your patients especially. That's because you're cutting on. I mean, my mom had an arteriovenous malformation, and this is when I was in chiropractic school. And so I came home during one of my breaks, and I woke up and she was sitting at the foot of my bed. I was like, oh, well, this can't be good. And she told me, hey, I have this AVM and I'm going to get surgery and, Dr. King is doing it, such whatever. And I was like, she said, I already know you have all these questions. I already made an appointment so you can talk to Dr. King. Y'all can have this medical thing going on, And so I was like, okay, she knows me. She knows me. And so I went to meet him and he was like, oh, I've done over, 200 of these, I said, Doc, I'm sure you're great at what you do. I'm concerned about the anesthesiologist. Who is going to help keep my mom where she needs to be while you do what you do? Oh, I only work with Dr. Brown. I don't know. I can't remember his name. And so I was going to take that quarter off of school so I can be with my mom. She's like, nope, you've already told. I shared too much with my mom about how people fall behind, when you're in the same group and all that. But my grandmother was still alive at that time. And so my grandmother came up to care for my mom. And I called, when surgery was to be over. And I asked my dad, I said, how'd it go? He said, oh, they had to reschedule. I said, why? Dr. Brown wasn't available. I said, see? Dr. King knew I would have driven 12 hours up there and gotten in his behind if he worked with someone who he didn't trust. It's important. It's important.
Yeah, I mean, you bring up some incredible points. One of the things I have a very unique background myself. I'm half Black, I'm half white, but I grew up in an Italian household. I actually spoke Italian first.
Ooh,
and so it was my
Okay.
first language. I'm actually going to Italy, this year, which is awesome. I try to get there at least every couple years. Great, man, amazing country.
Love
And it's
Italy.
nice when you speak the language. It's a lot easier. But what I was going to say is I always talk about how important it is for people to really have a level of comfort. And so and we see that obviously a lot of people, like you look at OBGYNs, right? A lot of OBGYNs are women. Women are more comfortable with women. Some women are more comfortable with men. We talk about all that. Actually, my next guest, my next podcast is an OBGYN, but being able to understand people's cultural background is really important. Not everybody is going to understand everybody's cultural background, but you have to make the best effort, that you can. I just happen to have a very different upbringing. So I grew up around a lot of Blacks, Jews, Italians, Russians, all these, because I was in the Bronx. It was just a big hodgepodge. So I've had, and a lot of different, Asian people from different Asian countries, Cambodia and South America, and people from Nigeria and Cameroon. I've had all these friends. So I always talk about this stuff because we are wrapped into who we are. Like our essence of ourselves is who we are. And if we're trying to help that person, we have to know how they're thinking. We don't have to invite every single patient to our house to break bread. However, we have to at least understand, why are they skeptical? Why don't they believe this? Why do they think spine surgery, is good? Because I could tell you, from certain things, some of my patients, especially from East Africa, are massively skeptic. When you say spine surgery, they think paralysis. Every spine surgery means paralysis. The older generation,
of course.
The younger ones, they're fine. They don't even question it because they grew up. They have TikTok. They have all this stuff. They
right.
You know what I mean? They know what goes on. But that's important. You brought up so many great points about people wanting to see people that look. But I think it goes even beyond that, because obviously we live and it depends where you live. In Atlanta, it's different. In Atlanta, if you want to see a Black provider, you go see a Black provider.
Exactly.
Okay. If you are in Bemidji, Minnesota, and you want to see a Black provider, there's two. There's two.
You have to drive.
You're going to have to take a nice drive, up to the Twin Cities. And so, but again, it's just about understanding the culture. And I love talking to people about their culture. Like if somebody comes in and they're like, for example, they're a Hasidic Jew, I have to ask them all this stuff because I'm from New York City. Or if they're whatever it be, I just love different cultures, because the more I know about them, the more I can treat them effectively. So yeah, that was a great. I love that, because my sense is that just Blacks or Afro Americans, whatever, because Black is that takes into account a bigger thing. We say African Americans, we're leaving out all our all the
even that has its nuances.
Especially in Minnesota, where we have so many Africans that live here, and they're great people. I have a lot of them in my practice. They just love them, and so I see them as being maybe even some of them. It depends on what their background is, but some of them even being more skeptical if they just heard one one thing. Like I'm not getting, or I'm not having spines, or I'm not. So there's just general skepticism about it. But I had this Bernard Tony on my show, and he's a PA, but he was one of the White House providers for years. So he had two administrations. So he was there with Obama, Obama and Trump administration. So he did, I think, 2 years in both. And we were talking, and he grew up in a really rough neighborhood. He's African-American. He talks about it all the time. He's a decorated military veteran. He's done all this stuff. But we got into this whole conversation about how that community, okay, and this is something that I'm just so in tune with. And it's not just that community, because I don't want to leave anybody out, because there are a lot of rural communities that are really struggling with education. But if you look, we just got into it because he's African-American, so we talked about it. If you look at these communities, these inner city communities, one of my biggest concerns is that they come in and they don't know anything about their healthcare and their behavioral choices and this and that. And again, it's not unique to that community, because we have a lot of rural communities. We see the same thing. So when I'm talking to people that have driven 4 hours from some rural community, if they've never been exposed to that, they don't understand. And they might be morbidly obese, like by 200 pounds, and drinking like some like huge, 150-ounce drink. And I asked them, and they're on a medication list, 25 medications. I said, how's your health? And they're like, it's very good, doctor. Other than my spine, I'm great. And I was like, okay, we got to start from the beginning.
Ground one. Ground zero.
But I see that so much in our inner cities, in our African American, and some of our Hispanic community here too, where they're like the level of being misinformed. I know Atlanta's different. It's a different crowd in Atlanta. It's different. But the level of misinformation in some of the lower socioeconomic groups, I'm not talking about, listen, Atlanta has a thriving, like very well-to-do African-American pie. It's such a great community. But I'm talking about like, we know what we're talking about. The people come in, they don't, no idea. So two things are a problem with it. So one is that they don't know, so they make very bad health choices and bad decisions, which leads to obesity, stroke, heart attacks, all these preventable illnesses. But on the other thing, and something that I do like to talk about, is that when you don't have, not because you're not intelligent, it's because you haven't been educated on these subjects, you are prey. You are a vulnerable individual. And so if you end up in the wrong office of anything, you might have stuff put in you. You might have like all these procedures you don't need, drugs you don't need to be on, whatever. And that goes for anything. You might go to some chiropractor that isn't ethical and say, well, in order to adjust your 75-degree scoliosis, we're going to need 150 sessions, right? Because they become prey because they don't know. And that's why I'm like so into education and telling people you have to be educated. Do not have procedures. Don't have treatment until you're educated. Like really educated on it. What are your thoughts on that? Like on these communities and how difficult it is? Because I know, like, and the other thing I love about chiropractic is you guys are so in tune with overall health and wellness and well-being of the patient, as opposed to just like a silo and just being, hey, just take this med because you have a high blood pressure, so you need to be on this med. That's not a strategy. That's just a medication that treats one thing. Root cause. So what are your thoughts on that?
The first thing I always say is that chiropractors have been talking about wellness for over 100 years. We were the first ones talking about wellness before anyone. So there's that the education is important, because there can be miseducation and just not having the resources to get the education. As far as the disparities with health with those in rural communities and those in the urban communities, typically it's either access to healthcare or getting the healthcare and not being listened to.
Yes.
And then there typically is a pattern too. Your children look like the parents. So if the parents aren't eating healthy and cooking healthy foods and being active and things, then that's what the children see. So that the parents and making sure that they are providing the best examples is paramount. I remember so I've been divorced for 17 years. So I had some friends that would pick my kids up from the Boys and Girls Club, I'll get them for a few hours. I'm like, oh, thank you. And they would take them out to dinner and they would say, your kids are weird. I said, why do you say that? They they wouldn't drink the pop. Well, I'm from Detroit, or the soda.
Yeah,
They wanted water, okay? And they wouldn't get the fries. I mean, even the server was, you don't want fries? No, we like the salad. We want the asparagus. We want the broccoli.
Wow.
Because they were taught. You know, they were taught. So
Yes.
children can be taught, and you have to provide them with that example.
Yes.
Children will always do what you do. They won't always do what you say. You know, so that's important. I had a discussion with a woman in the airport about just the disparities with healthcare, and how, you know, Black women especially, you know, have a higher incidence of having miscarriages or just stillbirths, and just the mortality, it's outrageous.
Yes.
And she said, why do you think that is? I said, I think it's because, again, my opinion, there's a stereotype that Black women can endure more pain than anyone else, as if we're just, you know, superhuman and we don't feel pain. So we can ask for some pain medication, let's say during childbirth, you know, and it's like, oh no, you know, you're not, you know, expressing yourself and not being heard, and that's huge. And then when you have that experience over and over again, well, then you stop saying anything. Or you stop going to a doctor, you know, altogether, because they're not going to listen anyway. And then another factor too is traumas and abuses that we have endured. Children, you know, unfortunately, where the most susceptible population are children, and so they have a lot of traumas and abuses that they're trying to live through or get through. And they've not had counseling, they've not had therapy, they've not had someone to listen. Like, I've had people call me and say, Doc, that's the first time I've ever shared that with anyone else. You know, the sexual, the physical, the verbal, the emotional abuse, you know, and it's there. I mean, I sometimes have to stop my discovery calls and just, you know, pause and wipe tears, because a lot of us are hurting out here, and we've not had the access or the courage to talk about it. Because in the Black community, you know, it's getting better, thank God. However, before, what goes on in this house stays in this house. You don't tell anybody about what goes on in this house, even though it's dysfunctional. And you know, full disclosure, all houses are dysfunctional, some more than others. You know, so I like someone said, so now you're not so unique. You know, so it's getting to the root of it. That's the thing. It's getting better.
I would say, you know, you brought up some good stuff. It's interesting because I was talking to a hospital group that wants to do a lot more community outreach and things like that. What I find is that a lot of the dollars, okay, that people want to donate, they want to open this clinic, they want to, you know, do the thing. But what I'm trying to get at is more educating the people about their health. And so we work at some hospitals that are, you know, in the inner city, right? So what I try to tell some of these executives that want to roll out these programs, as you know, we help them through some of their ideas and their thoughts, is that if you don't want them to have all this care and fill up the emergency rooms and use these clinics for their health, you have to educate them as to what their lifestyle choices are. And so their rates of diabetes and obesity and stroke and Alzheimer's disease, and we could go on, you know, we could list hypertension, all these other things. If you just watch the lifestyles. Now, listen, I'm not going to give a pass to just Americans in general. Everybody knows, like, the stuff that I preach. We have a problem as a nation from rich to poor. However, it as you get lower in the socioeconomic rung, obviously it gets worse.
Yes.
And so we really need to educate them just on if you just did lifestyle changes and expose them to some wellness clinics, chiropractic clinics, you know, places where they just get their blood pressure checked, even when they're young, and do you know, like, you know, check their, you know, their bones, even though in the Black communities, but even in the lighter skin Hispanic communities, they also have some osteoporosis and some other stuff, even though, you know, in the Black community, there is osteoporosis, just not as much as in the white community. But doing a lot of these testing, that is the important thing. Because if you don't educate them, you could open 10 clinics. They ain't going to go there.
It won't matter.
What are you're opening the thing? They're not going to go there until they're sick. Going somewhere when then you're in kidney failure and need to be admitted to the medical ICU is very different than coming to see you because you just want to stay well and you want some tips. And I live my life like this. Well, you might say, don't eat that, or go on intermittent fasting, or do this or whatever. And so I think we're not focusing on that. And the other thing that you said that's so important is that they're skeptical of them. So they don't want to go in. They don't feel like it's going to do anything because they don't understand. And so they don't go in until they're too sick. And then what happens happens is that because those communities, they're marginalized in a way. I don't know exactly how to say it, but then they fill up the emergency rooms. They're sick. They're everywhere. You know, they're just everywhere. And then they're just eating up all this healthcare, but it's also ruining their lives and their families' lives.
Absolutely.
So we have so much work to do as a society, just in general. And the same stuff, like my rural patients, some of them come and I'm like, I cannot believe. I'm like, well, when did you see? They haven't even seen, they've done nothing. They haven't seen a doctor. They haven't seen anything. And they're sick. They're coming in for their spine problem. I'm like, we got to get you in to, well, we got to start you off with like some of the great internists or family medicine or naturopath or functional medicine. I like to use all these different specialties. I was like, you don't need me. Let's not worry about you have back pain because whatever else you got going on. Like, I know your MRI shows that your disc is degenerated. That's not why. If you fix these other things, you'll probably never see me again if you fix this stuff.
That's it.
And so, yeah, that was it. We could talk about this stuff for days because, and we just need to bring more like-minded people that just want to educate and teach. And, I'm trying to do it on a big global scale, but I do like to target those communities because it's like so many people are lost. How many amputees, it's funny. This guy, Bernard Tony, when we did his thing, I asked him, well, how do you really, he's like, here's how I tell people from, the neighborhood I'm from or from lower socioeconomic, because they're just like, well, I got the sugar, so I'll just get the diabetes meds and it'll be fine. He's like, okay, let's rephrase this. He's like, how well are you going to get around when you have one leg or no legs? How's that going to work? And he's like, oh, what do you mean no legs? And he starts giving him all like statistics on amputations and this and that and disparities. And all of a sudden he's like, okay, what do I need to do? So sometimes you have to talk differently to different people. And again, that's that whole cultural thing. Because again, you're going to talk to them different than you talk to, somebody might be black, but if they're the CEO of a Fortune 500 company, I think they have a little bit more.
A little bit more.
They want genetic testing and they want every MRI and they want to have all their other stuff done. So
they won't call diabetes sugar either.
They won't call it the sugar. I got the sugar.
It's like, no, you can die from that.
Blindness, amputation, every heart disease. Listen, how much of like this high fructose stuff is responsible for Alzheimer's disease. There's so much coming out on how obesity, especially childhood obesity, then translates to people getting Alzheimer's disease or having high sugar diets. I mean, there's so much stuff coming out, but you know what we need to get to now?
What?
Your favorite stuff, because we could talk about this stuff all day. But one of my passions, it's interesting. So my clinic we started as only like an orthopedic spine clinic, but now we're majority neurosurgeons. And so I'm even though I'm an orthopedic spine surgeon, I love the brain now. I need to know about it because I run our company. And so, I've learned so much about neurosurgery and the brain, even though I don't do it myself. I do my spine stuff, but we take care of all these people. And so the brain is the obvious, it's the most fascinating, structure. So love brain. And I've gotten into a lot of it with light therapies and all these other stuff that I talk about ad nauseum everywhere. But the problems with the brain and so if you even take either neurological conditions, psychiatric conditions, and the combination are the trajectory is directly straight up. And so the things that I know you're passionate about and in researching PTSD, ADHD, all of the depression, all of these other things, and I have become so passionate about it because there's so much of that overlay. There are very few patients that are struggling and just in general that have a lot of pain that don't have other psychiatric overlay, and it either preceded it or it's because of it, or they're all, I don't even know, it's chicken or the egg. But so learning about these things, I mean, PTSD, people have PTSD just from having surgery sometimes, or they have whatever. I'll have all these veterans that have true PTSD from their experiences. So treating this stuff has become passion, and that's what really attracted me to having you on the show, because you are you're a neurofeedback master. Your book just came out. We'll talk about that in a minute. Yeah, please show us. Yes, and we're excited it just came out, by the way.
Yes.
And we'll talk about it, in a little bit, but and how to treat the brain. And for those, again, that follow me know that I'm always looking at scientifically vetted, holistic ways of treating as many human disorders as we can, because if we can avoid complications and risks of other things that are being done for these things, it's better. And I had Dr. David Barron, who is the U.S. Olympic psychiatrist. He's been doing that for decades. It's brilliant. He knows everybody. We talked about Simone Biles and everybody and all like the issues that when we talked about PTSD in athletes, that's a whole other crazy. I mean, great discussion. And Dr. David Barron, brilliant guy. And I actually just saw him in DC a couple weeks ago. We were all lobbying like as part of the same group. But anyway, I asked him about the way he treats, and he was right away. He's like, I try to do everything non-medication in the world of psychiatry. Now, there are very serious psychiatric disorders. And again, this podcast is not medical advice to anybody from either of us. We're just here having a conversation. You need to see your own, dedicated doctors or providers or whatever to get your medical care. But he was very much, he's like, unless it's a very severe condition, resistant depression, people that have suicidal ideation, well, you need to treat them. Obviously, you don't want them to have something catastrophic happen. For the most part, he uses all these other techniques, neurofeedback, which is a big one, transcranial electromagnetic stimulation, there's so many different ways to treat the brain. My big passion has become treating the brain with photobiomodulation, and there's a lot of good stuff on depression. But the truth is they all work together.
Exactly.
To get people better. And the more that we can combine these modalities, the better we can do for people, because people are hurting out there. It is, you know what, you and I both, we talk to people all day, every day. And people we just say, my favorite, and some people like this term, some people don't, but I always say, like, I'll walk out and I'll talk to one of my PAs and I'm like, struggle bus. These people are on the struggle bus. I mean, the struggles in our country, the wealthiest country in the world, which spends the most money on healthcare per capita in the world by a significant margin, mind you. Why are we struggling so much? That's my first question. Before we get into specific things, why is our country, we can talk about the whole West, but why are Americans on the struggle bus with mental health issues? What is the problem? What are we missing?
Goodness, that's such a loaded question, Doc. I start with just getting outside, being active, getting the vitamin D. I mean, that's like with the pandemic. Good Lord. Isolation. I said, you can still go outside. You can walk around your block. You can talk to your neighbor, in a good distance. Getting outside and being with nature is so healing. And we don't do enough of that. We have so many gadgets now. Other countries, I mean, everyone has recess like every day. I think I had recess through 8th grade when I was growing up. Now, I was a substitute teacher for 4 years in a middle school, and they have 20 minutes to leave the room, eat, and get back to the room. And there's no outside time at all. I mean, we've taken away naps from kindergartners. Adults need naps. You don't think a kindergartner needs a nap? I mean, it's that. And then
you know what, I will, that's a good thing, because I know I gave you, honestly, I gave you a loaded question because I just like to do that on my shit. It's just fun. But I think that one of the things I've talked about with many people, I had Dr. Fujian Zine, who is really a world class. She does phenomenal work with mental health disorders. And I really got in, we really talked about how to help, but the fact that this and I had another really great guest, Nicole Jafari. And one of the things that we talk about is the influence of social media and mass media, and how you hit it on. And the reason I ask you is because this non-going outside, non-going outdoors. I've had other guests, this Dan Ziem. We talk about like going outdoors, getting sunlight, being part of nature. This is what we do. Okay. I have like this. This is
oh my gosh.
I mean, this is a teenagers at a desk. It's 10 of them at one table. They're all like this.
Oh my gosh. After dinner. We're not even talking to each other.
No, you got to put the phone. We got to, everyone has to put their phones away, including myself, because I want to know what's going on too.
I'm working on it. I now have my phone on the other side of my bedroom, because I'm working on it too. But it's like, you can lose hours. And then the neck, and most of us don't want to go around looking like a hunchback. And so I'm like, well, that's where you're headed if you keep doing that. When I would take my car in, the service advisor would always laugh at me. He said, I always know where you are, Dr. Holmes, because you're the only one here looking at your phone like this, trying to make sure that I'm looking up to make sure my cervical spine is doing well. It's the basics. It's the basics. And again, being an example, and then crafting a talk now about rearing resilient children, playing a sport, playing an instrument, just knowing how to communicate and accept a defeat. Like, you don't get a trophy just because you showed up. You actually have to do something that is phenomenal in order for you to earn that trophy. I'm not a participation parent. I'm not a coddler. I don't do that. And so many parents are doing that. And that's why these children are having these challenges. And again, notwithstanding, there are a lot of people who've had traumas and abuses as children that were not protected. Or they told the parent or the caregiver, whoever, who didn't believe them. And then guess what? That turns into some challenges going forward, because now you've experienced this, but someone doesn't believe you. And so now you're like, well, did it happen? And you start doubting yourself. And then it can be a whole snowball effect. And then, if it happens to run in your family, then you grew up with an anxious parent, and it's a lot. I tell my dad, my mom has passed. I tell my dad all the time, I said, thank you so much for my sheltered environment. I didn't know what divorce was until I was in the 7th grade and was still like clueless. Like, wait a minute, what do you mean your dad doesn't live with you? You're going to go visit him. That the family unit it's not, in a lot of communities, it's not as strong. And so now you have parents who have to work, 2 and 3 jobs, or, and so the time with the child is replaced by the phone.
Yes.
I try not to just snatch a phone out of a baby's hand. I'm like, oh my gosh, like a book. Like my parents saw it as a coloring book if I was too young to read, or something that was going to manage the time in a constructive way. So I just,
listen, I absolutely feel your pain. And, some of the guests I've had on have talked about, even before the age of 2, literally having 0 screen time, 0. And
there's so many other things you can do. Mommy and me. I took my kids to music classes, just take them to the playground.
I can see your frustration. It's fun. You're getting like me when my kids were young and they wanted to be on stuff. And I probably didn't handle it well, because I would just get upset. And you talk about the snatch thing, I would just say, done. I'm done. I can't watch you anymore. And it was probably not the necessary, because like you said, we all have issues with our own children and having to, deal with. And, we've been lucky because our children are great kids. All thanks to my wife. Has nothing to do with me. Everybody knows I say that all the time. I'm okay. I'm a pretty intense guy, to say the least. I've mellowed out, but earlier I was probably over intense with a lot of things. But let's go back to all of these disorders. So now we've got all these kids struggling out here, and you have a great story of a child that dealt with ADHD and all this other stuff. But kids are struggling with depression, and they've got and you listen, suicide rates in children during and after the pandemic. Kids were left at home with abusive parents all the time, with nowhere to go, right? Because the school was their escape,
the protection. Absolutely,
that was their protection.
Absolutely.
Now, and then not to mention the kids with autism. When I look at the charts of autism, I don't know. I know that let's not get into autism theories, because I know and
you don't have a few.
many chiropractors. I have a lot of good chiropractic friends. They also share some of your views on vaccines, which again, that's controversial. We don't need to get into all that stuff. It's very, very interesting. However, the rates of autism are off the chart. But if you look at almost every mental health disorder in almost every demographic bracket, it's going the wrong way. You've got elderly people that are struggling because they are addicted to their cell phone, and they have all the dopamine problems, all the stuff, and they probably need, So let's talk about neurofeedback. So before we get into how neurofeedback, which I'm a massive believer in neurofeedback, I'm so thankful that you're on the show, because people really need to know about neurofeedback. And actually, my partner, kind of on the wellness side, Dr. Dan Sipple, he's a DO. He's a massive proponent of neurofeedback. So I have to hear this constantly. He's obsessed with neurofeedback. And so can you tell our audience that they don't even know what neurofeedback is, right?
Sure.
They know feedback, like somebody, giving them a response. What's a very lay person's terminology of neurofeedback, and how can it affect changes in the brain?
So neurofeedback is a sophisticated form of biofeedback. It's a way that the brain can learn and get retrained how to regulate itself. So we all have brain waves as we're sitting here. Brain waves are just, they're all over. And so there are certain frequencies where the brain functions very well. And then when the brain is not functioning very well in that frequency, that's when you start having symptoms. Let's say, focus and attention issues, or anxious thoughts, or depressed mood, or, suicidal ideations and that. So this therapy works, it's a computer-based program, and it works to make sure those frequencies are within the range that they need to be. And it's non-invasive, it's drug-free, and it's easy. And that's the thing I love about it the most. No side effects. The results can last up to 30 years, in some cases up to 50 years. So it's phenomenal. I'm just so thankful that I stumbled upon it. And it's been around for over 50 years. And so that's the thing that hurts my heart the most, is that most people don't know about it, and it's been around for so long. Early on, Neurofeedback received grants from the government for research. Yes. And people are like, oh, I'm like, yes, so yes, that's what neurofeedback is in a nutshell.
Yeah, and neurofeedback, just for our audience to understand, is a technique that's widely used, for example, in the US military. I mean, neurofeedback are, brave women and men of the military. I mean, PTSD, anxiety, depression. There's so many different issues, and they are using neurofeedback, and there's different types of neurofeedback, right? And so you espouse like very specific type of neurofeedback. There's just different neurofeedback. Actually, one of my partners, who's a brain surgeon, he developed this glove that does neurofeedback, well, a type of neurofeedback with the hand. And then we're going to try to, use his device in our wellness centers, and then just titrate it with EEG, like doing quantitative EEGs and work that way. But they've studied. So tell us about the type of neurofeedback that you're doing. So just like really describe it, right? The patients that you're doing something to them, and then they see something that walk them through what it is, because otherwise they don't even know, like we could go into deep discussions about QEEGs and different changes, but that's going to be like
I don't, as like I wrote the book, like I tell people I wrote this book. I'm not trying to get a Pulitzer Prize in writing or an award in neurofeedback. I want everyone to understand what neurofeedback is. So first of all, we have to see if you're a candidate, and so there are things like that. Then we get a brain mapping, like you mentioned, the QEEG brain mapping. It shows where your brain is at the time. It's a functional assessment. It's not diagnostic. So when I get the report back, I can't say you have ADHD, you have anxiety, you have depression. I can say this is where your brain is functioning well, and this is where it's having some challenges. So after that is established, then we have different specific protocols to address what's going on in your brain. And we take the worst one, is the best way to say it. So the one that needs to be addressed first, and we go there. So the therapy is you're connected to, in my case, we have laptops. And so you're watching something, you have sensors on wherever part of the brain we're working on, and it's connected to your computer, and you're watching something on a streaming device. So we know all those, I don't know if I can mention all those companies, all those that we love.
Yeah, you can. You could feel free to. Yeah, you can feel free to mention.
Netflix, Hulu, Plus, Amazon Prime, any of those, even YouTube. So you're watching a television show or movie for 30 minutes. And during that time, when your brain is in the frequency that we want it to be in, you'll see what you're watching like you regularly would. It's nice and bright, and you hear it well. When your brain starts going to that dysfunctional pattern, then the screen will fade and the volume will go down. And it's called operant conditioning. However, I call it a positive and negative reinforcement. So the positive reinforcement is that you get to see what you're watching like you normally would. The negative reinforcement is that the screen fades and the volume goes down. So the only thing your brain wants to do is to see whatever you're watching like you I normally do. So that's the instantaneous part, that's the biofeedback part. So when you're connected, the computer knows when you're not in that frequency. And so it's not sit there and concentrate like go. It's very subtle. I had a patient in his 60s. This is when I was just doing it in my office. He completed 3 sessions. And he said, okay, doc, when are we going to get started? I said, that was your 3rd training session. He said, I thought the screen was going to fade. I said, we completely black 3 times. You didn't see that? He said, no. So the next time he came in the office, I took his phone, set it up on my tripod, and I recorded his session. Even then, he didn't see it until I took his phone off and showed him. He was like, oh, because it's very subtle. He's just watching a program.
Interesting.
Kids I had parents like, oh my gosh, if he asked me one more time if we're going to therapy today, because it's fun. They get to sit there for 30 minutes and have uninterrupted screen time, and the parents aren't on them, and it's helping their brain.
No, it's amazing. No, it's amazing, and we could talk a lot. Could you just very rudimentary, just talk about the different waves that you see on the, just did like really like, I mean,
Sure.
square one, somebody walks in off the street, you're like, hey, we're going to teach you something. Come in this classroom with the other 20 people we just forcing to do this. Just talk about what states are considered states of tranquility or focus versus disorganized states where your brain is clearly not functioning. You feel terrible. You're all, your brain is completely disorganized. What's the difference?
Sure. So the delta state is the one that you are like dreamless sleep, like a state of meditation, and then you go to
Yes.
theta, which is a little above the being sleepy. You're in a
Mhm.
little bit of a calm state, but you're not asleep. And then you have alpha, which is a little more excitatory. That's more for the focus, and when your brain isn't doing well there, then that's when you're having a lot of challenges. And then you have the theta. And so they all have different frequencies. And even in my research, they have different ranges of the frequencies. So unfortunately, they're not even on the same page as that. The way that those frequencies function determines what you're doing. So the part of your brain that you're using, say, to write your name is different than the part that you're using for, I always say, advanced calculus and physics, which not my strong suit. Okay, so the goal is to make sure that your brain is functioning as efficiently as possible so that you can take care of those tasks without difficulty. So the brain fog, get rid of that. The memory challenges, get rid of that. My daughter, focus and attention issues, that's no longer an issue. That was her primary. Anxiety was her secondary. Depression was her tertiary. So, just when you get those frequencies in those correct patterns and those correct ranges, the world opens up. All those symptoms decrease, and those patients who come to me who are on medications, I tell them, full disclosure, I'm trying to get you off of those medications.
Yes.
When your brain is functioning as it should, then you'll start experiencing the side effects of those medications worse, because your brain is like, wait a minute, your body's like, wait a minute, what's going on? I said, no, that's a good thing. That means I can send you back to the doctor, say, hey, will you please decrease my dosage? So again, I don't say get off of that. I'll just say, hey, go back to your doctor and tell them what you're experiencing. So decrease, and eliminate it. Those are my goals.
So, one of the things so neurofeedback, right? So big proponent of it. And I think that it needs to be a part of treating all of these kind of disorders that we talked about before, but in conjunction with other things, I think that the ability, for example, to treat PTSD when you do a multimodal approach.
Yes.
Again,
yes.
for everybody out there, I don't have my boards in neurology or psychiatry. However, I've read many textbooks on this, and we're working through in our wellness centers, and we're about to open an entire integrative clinic that we're doing these things, but combining the modalities. Like, for example, one of the things we're going to be doing for some of these different disorders is combining neurofeedback, photobiomodulation to the brain, which has a lot of things, with transcranial electromagnetic therapy, because you're just manipulating the brain, because you have to heal. So the way that photobiomodulation works is it's creating synaptogenesis. So it's mitochondrial function improves, blood flow improves to the brain, but you're actually experiencing synaptogenesis. You're literally healing the hardware of the brain. It's more of the hardware part of it. Now you add, then you add neurofeedback in, which is the software. The software is different, right? You're a programmer. You're programming the way, because even if you heal some of the neuronal injury, like from a TBI or something like that, if the connections, even if they're connected again, if they're not firing in the right places, and that's where I see like neurofeedback. And then you take something like transcranial electromagnetic stimulation, that's like you're jump starting the brain, right? You're like, boom.
Exactly. Let's go.
Right. That's for the audience that's not familiar with it. It's like ECT. It's a low level of ECT where you're just, but not like ECT where you're stunned or anything like that. It's just different. But combining these modalities, can you talk about how neurofeedback plays into neuroplasticity and rewiring those connections? It's so important, even in stroke, like in stroke victims.
Yes.
Neurofeedback. I don't understand how people treat post-stroke without doing some neurofeedback. It makes I can't wrap my mind.
Make it make sense.
I'm an orthopedic surgeon. Like, why am I the one that's like, you're not doing neurofeedback? What?
Right. Well, and unfortunately, because people I have never heard of that. Why haven't I heard of it? Again, I have theories on that. We're not going to go into that.
Yes.
Neuroplasticity, that's exactly what I was going to talk about. So neuroplasticity is the body's ability, the brain's ability body to learn how to function, how to do things again, how to do things differently. I played sports. I was a softball and I won't say basketball phenom, but those are my sports.
Hey, if you were, you were. You could. It's okay.
I did well. I did well, but mainly in softball. Let me quantify that. Basketball. So I was a pitcher. So I took pitching lessons, had a pitching coach. And so most people are familiar with muscle memory. So, the more often you practice anything, then the better, you don't even have to think about it. You just, like I tell people, I would take the ball and, get the call, take the position and throw the ball. Same thing with the brain. Neurofeedback is essentially exercise for the brain. The more often you train it, that's why we call them training sessions. Guess what? The better you'll be. Anything you train on, well, you become an expert at it, at some point. So same thing, like with post-stroke, concussions, traumatic brain injuries, autism. I mean, I've had people ask, well, what kind of results can we expect from certain conditions? I say every brain is different. I can't sit here and guarantee that your nonverbal child is going to start speaking. I can't say that. However, I have had patients who, like the stems that they were having. I had this one patient who had like 20 stems, like a day. And he went, after working with me in my program, he went to like 1 or 2 a week. People, they didn't go away automatic, for good. I said, well, goodness, I'm going from 20 a day to 1 or 2 a week. Like that's phenomenal. But most people are expecting that it's going to be an overnight sensation. Everything takes time, and the brain has to have time to change and adapt and rest. So it's important to go into it knowing that it works well. And there's certain conditions where it's going to take longer, like Parkinson's. People say, what about Alzheimer's or dementia? I said, if it's early onset, great. But most people think, oh, they're just getting they're older, getting older, and no, you're supposed to have a vibrant brain. Yes. Memory, all like I tell people, my goal is to be as a centenarian and still driving, come around. I may come around a corner on 2 wheels because that's how I drive, and still like, hey, how you doing? What's going on? You keep everything active. I think people retire and think that's they just sit around and do nothing all day. No. My dad will be 86 this month, and people are so amazed. I said, well, because he's active, he does neurofeedback. He played football in college. There was no concussion baseline. He said, I can't tell you how many times my bell was rung. And he used to say, I have CRS. And I was like, central respiratory. I'm like trying to figure out. He said, I can't remember. I was like, oh, because I'm not in that generation. I don't know what that was.
Love it.
And so, after neurofeedback, he doesn't say that anymore, and it's like, I just can't believe I said, and my aunts and uncles are a little jealous because they can't, they're not where I live, but it's a phenomenal therapy. And I'm just thankful that I'm able to offer it.
Yeah, I think there's excellent studies on ADHD, right? The American Academy of Pediatrics completely supports it as a level 1, research thing. If you look at, there's good stuff in PTSD. There's military things that people can go, again, we don't want to bore people to death by listing, 20 studies on this and that. Right. It's more about, it's being used in autism, in all these other things. But it's interesting that you bring up we talked about stroke, but it's interesting that you bring up elderly people and just dementia in general. And it has become, that is one of my top 3 favorite subjects. And the reason that I've become so interested in dementia. So first of all, in Minnesota, in the state of Minnesota, there's 97,000 people in 2016 that were diagnosed with dementia. And just from caring for them, we have less than 3,000 beds in this state that are specific memory care beds. Now, there's a lot of beds, but we don't. How are they being treated? And then what are they doing? So one of the things we're doing, because we are engaging with all these different groups and talking about it in elder care, is thinking about, well, if they're going to be in these facilities, why are they not exercising their brain, which is what neurofeedback is, which is brilliant. That's my favorite. I love that exercise of the brain. You're exercising those pathways, right? You're strengthening, just like in the batting cage, right? Hitting a softball.
Yes.
It's that thing.
And if you don't, guess what? If you don't practice anything, you're going to become sluggish at it. You won't remember you'll remember, but you won't be great at it again.
It's crossword puzzles on steroids, right?
Exactly.
It's such a strong way to connect. So I think in the elderly population, whether they have early dementia or they're just having, normal, because the frontal lobe, we have decline as we age, especially after age 70.
Stay hydrated too. A lot of them
Yeah,
don't drink water for some reason. I don't understand that. Okay.
no, they don't do, I mean, like we can,
Oh,
again,
okay.
lifestyle is my, but I was gonna say, like, for these elder, the reason that I got so into it, and then we wrapped it back into neurofeedback. So we have this entire program for elderly patients. But if you combine, so there's so much good work being done right now with light therapy to the brain for elderly, especially like in the dementias, which showing improved cognition, improved ability to do tasks, all these things. And now if you combine that with neurofeedback, what a powerful way to keep us. So because if you don't have your brain, even if your body's good, even if you're one of these lucky people that has led a reasonable, and your heart's okay and your kidneys are okay, and so and you have some degree of mobility, right? If you don't know who you are, what kind of, that's not a great existence either. And I think a lot of these things, can definitely help. And I think this combination of therapies, and I think we are, especially with AI and having AI help us to look at some of the studies and kind of aggregate the different methodologies, we are going to find some good stuff. I think people are going to be like in their early hundreds. A lot of people are going to be sharper than 50-year-old. Yeah, and you're the first.
Present company included.
I know you are. I know you are.
I do neurofeedback. I set myself up for stress relief, so it's not just because you have a mental health challenge, it's because you want to maintain or elevate. I have my youngest daughter is gifted and accelerated. She uses it for enrichment. I mean, there's so many ways to use neurofeedback therapy. It's just phenomenal.
And then there's different ways. We didn't get into all the neurofeedbacks, and everybody will. I want you to plug your book again, because I do want people to get it. So I want you to you held it up too short. Why don't you hold it up right now? Right, Transform Your Brain with Neurofeedback, already on the bestseller list. Please go and get her book. Phenomenal. Like, people just need to learn about it. But there's different ways to look at it, right? Through functional MRI, through different stuff. There's different types of ways to see what the brain is doing and how we can have that dialogue with the brain and exercise it to get the the desired results. So I think this has been like just a wonderful broad. I mean, we covered so many different. I wish this podcast was 5 hours long.
Oh my gosh,
we got more work to do, but in respect of people's time, because once you get over that 2-hour mark, people are like, okay,
right.
There may, like, without, I'm completely apolitical. I never talk politics, but for example, like, yeah, maybe there might have been a convention speech that was like the longest one ever in history.
Right.
Even the staunchest supporters are like, it's a bit long, so there's only so much people, unless they do a lot of neurofeedback, then they'll listen to a 5-hour podcast.
Exactly, like they're there, they're tuned, they're dialed in. It's yes.
Yeah, but I just think that we got so much out of this. I mean, great information on chiropractic care and what it's all about, and people don't need to be afraid, and they should try it out, especially when something has such a low risk. There's no reason not to do that. And then all the other and then we talked about different communities and and how to look for them. And then the big one, which is on the on the neurofeedback. Is there anything else that you'd love to share with our audience? Maybe a story about a patient that you thought, this person, I don't even know if I can help them, and then it was like the most miraculous thing you've seen. Maybe share with us a story. What's your favorite patient story? Yeah, go.
I'll just, this one, we talked about suicide. I had a mom call me. Her daughter had just been released from attempted suicide 3 days prior, and she was like, we got to do something. And I was a teenager. I was like, what could have been going on that was so for you to go that route? Yeah. And so she, I have different levels of programs. She was, of course, a severe case, and we started working. She was diligent. She was committed to the program. She was completing her sessions every day. I was loving it. And soccer season was coming up, and she plays on the soccer team. And her mom was like, oh my gosh, she won't be able to do, the sessions a day. And so I said, this is a good thing. We want her to play sports. We want her to interact. Yes. We want her to have, connections and friends and all this. And this is a good thing. And so I said, it's okay. And so I talked with the student, and I said, well, how's the season going? She said, well, I'm not a starter. I said, you don't have to be a starter. I said, you having fun? Yes. I know you have more fun, you win.
Yes.
So eventually her mom called me, said, she's just rolling her eyes and sucking her teeth at me. And I said, like a typical teenage girl. Oh, okay. So she had a complete transformation. Just was, back to herself. She was involved in school. She loved soccer. Her whole life was transformed. I mean, even, becoming a typical teenager, even though it may not be the habits and the mannerisms that, we love, it's much better than the alternative, is what I told her mom. And she was like, "You're absolutely right. So we'll take the sucking of the teeth and the
Yeah,
rolling of
yeah,
the." I mean, as a parent, I just couldn't even imagine being in that position. Like, what
yeah.
do I do? And thankfully, her parents did not want medication to be the answer. So I'm
Okay.
so thankful that they found their way to my office, and she's thriving now.
You know what? I usually ask this question, so I'm just going to ask it, even though we're at the end, because we didn't even cover it. We got into such great conversation about so many different things. I'm an MD.
Mhm,
I
mhm.
am in this world, but obviously I do all this holistic stuff too. So I'm just trying to walk both
Multifaceted.
worlds. I'm
Yes.
gonna give you a loaded question that I've given so many of my guests. Some of them jump right in, and some of them are like, "That's a lot to answer." Why are people in our society so wrapped into the only thing that's going to help them is medication and procedures? Why did this come about, and what do we need to do to listen? I'm a surgeon, and I see it's a big problem. I get into arguments with my patients that want surgery. I'm like, you do not need an operation. They think it's like, this isn't like massage envy. Oh
Right.
yeah, we'll just make an appointment and we'll just cut you open and put some
Cut on
screws
me. I'm
in.
good.
So but is it because the big corporations have done such a good job of completely brainwashing the American public?
Ding, ding,
Is
ding.
it all these other things? But I mean, like, how can we get people to be CEOs of their own healthcare and understand that there's so many things that can be done? And again, I want to stress, if you have serious problems or you really feel sick, you should see a doctor. You should
Oh,
go to the
absolutely.
emergency room and all that stuff. But
Absolutely.
in general, but if you're just like, I just don't feel well, we don't do a good job of that in Western medicine.
No.
And people end up going down rabbit holes that are not good for them at all. And I just did a post about Groundhog Day. And a
Mm-hmm.
lot of people they're just trapped in this Groundhog Day where they're doing the same stuff. It's not working. So how
Yeah.
do we get people to open their minds and understand that there are forces that have kind of brainwashed them to think that you can't fix anything without a pill?
Yeah, I'm so glad you asked me that question, because the American Medical Association has done a great job of making people think that medication is the only answer. If that's what your parents did, you typically do what your parents did. Like, I didn't experience a chiropractic adjustment until I was man, and I'm thinking, man, I was a softball player, as a basketball player, I could have had a better jump shot. I could have, maybe been a better pitcher. Just all these things, and a lot of times we're just closed to growth. We don't want to learn anything new. This is the way my mom or my dad has always done this. This is how my grandmother has always done this. And even if the outcome from your grandmother, your mom, or your dad isn't great, you think that's the route that you're supposed to go. Supposed to. So it's lack of education, and then lack of wanting to learn something new. And my whole thing is, I've had people tell me that if they didn't see me, they would have thought that I had some kind of Asian background. I might, in a former life or something. I've always had an affinity towards the cultures that tend to be calm, and everything flows. And I'm like, what are they doing? Those people who are in those blue countries, they do Tai Chi, they do these movements every day. They're active, they're outside, they're walking. And we can learn a lot from others if we just take the time. It's like you said, there's a lot of research out there. Just like,
Yes.
we're the lowest as far as countries. I mean, I don't know if we're the very bottom, but just obesity and health in general, because those other countries have the kids out playing, have them, reading an actual book that, you flip the pages, just simple things like that. And we're so closed off, thinking that, we get the title of the best country. However, there are a lot of things that we can learn from other countries on how to do it better. And when you're open to other options, then that's when your life can change. Just one thing. That's just be open. I was talking earlier today, one of my daughter's coaches, I'm sure, I don't know if it's attributed to him, but he was saying, I don't fail, I learn. So you learn how to not to do something, when it didn't go well the first time. So something, a lot of times things don't go well, then you do something else, try something else, and be your own advocate. That's a huge thing too. A lot of us don't, like I tell people, I love it when my patients ask me questions. That means they're trying to figure it out.
Yes.
And if I don't know, I'll say, you know what, I'm not sure. Let me check on that for you. Because guess what? Like I say, doctors know a lot about a little. I'm not supposed to know everything in the world. That's why everybody has their gifts and their specialties. Yeah. So, do your own research. You have all this technology at your fingertips where you can, and at the same time, make sure you check your sources, because just because it's on the internet doesn't mean that it's true. So taking that time and knowing that you are your most valuable asset. Health is wealth. When you're healthy, you can go and do and be anything that you want to do. However, if you have all these morbidities and comorbidities and just, you're just barely, experiencing life, it's a tough road. It's a tough road.
Yeah, I talk about that all the time. What's the point?
Exactly.
What's the point? You could be a billionaire if you don't feel well, but we don't think this way, and we don't anticipate. And what I'm trying to get to my audience, and again, that my platform is not to, I'm not here to try to, it's not about conspiracy theories, not about other stuff, but it's our mentality just in the West versus the East versus other countries versus Africa, whatever, it's so different. There are forces at play, and we just have to wake up and understand that we as patients, because I'm a patient, my family's, we're all patients too. Yes. We have become commodities to be exploited for stuff, just like social media companies exploit us for whatever they're doing. And, people that are selling whatever, definitely the healthcare world and big industry and big food and everybody, else, I'm not calling anybody by name, but
we know who we're talking about.
Yeah, we know who we're talking about. But again, the more vulnerable we are, and people are like, oh, that's not a vulnerable. Well, if you're vulnerable, if you don't have the information, you're totally vulnerable.
You can't make a choice.
You could get sold any kind of bill of goods. Absolutely. and you're going to go with that. So that's why, like, I love it. Doing your own research, health as well. You're hitting all the buzzwords. And then my favorite, attributed to my friend Margaret, is be the CEO of your own healthcare.
Yes.
And not rely on you or I or anybody. Yes, rely on us for our expertise. We've gone to school for a long time. We did this other stuff, and certainly listen. And yes, not everybody's opinion is going to count the same. Experts are different than the other people. However, you need to look at different specialties, different things, and just figure out what works best for me. What's better for my cultural values? What's better for this? And the truth is, the one thing I just want to get out just about just the medical profession in general, right? And that also goes for, you guys, for chiropractic, whatever. We have to understand is the people that we're treating, yes, if it's a life-threatening thing, we just do what we have to do. I get it. But for everything else, it's their body, they have to make a decision as to the direction they want to go. So even if somebody sees me, and as a spine surgeon, I'm 100% convinced, and I'm very holistic, always looking at holistic stuff first. Right? Convince more people not to have surgery than to have surgery. If I really think somebody needs surgery, but that doesn't go along with their cultural values or their religious, or they have a religious objection, or they're not ready for it mentally or whatever, all I can do is not talk down to them, not judge them, just understand them and just say, hey, listen, this might be a long-term consequence of it, but it's ultimately, it's their decision to make what they, that they want to do. This healthcare system where we just preach to people and tell them what to do, and having convinced them that whatever we say is that's what I need to do. It's not going to work. It doesn't work long term, and this is what we've gotten for it. It's a mess. It's a complete mess.
Get a second, third opinion. And that's another thing too. I mean, if it's like someone will say something to me and I'm like, and then I meet someone else and they say the same thing and they don't know each other. I'm like,
yes.
Like, wait a minute, there may be something to that. So, that's.
But the other thing is, but you also don't want to stay in the same silos. It's just like, for example, again, not talking about politics. Oh, you know what? I never talk about politics on my stuff, but let's talk about sports teams, right? If we are all Atlanta Braves fans, right? If we're all Atlanta Braves fans, you don't only ask the Atlanta Braves fans,
Exactly.
about what you should be like, what gear you should, because they're all going to tell you just generally the same stuff. Maybe
Exactly.
I'm a Mets fan,
Mhm.
unfortunately, because I grew up in New York. Ask some Mets fans, right? They probably don't even want to talk about baseball, right? But
Sure.
you can ask them,
Sure.
and then if you get some agreement in between, okay, that'll work. Or maybe they say, yo, and wear this and wear and a combination of the two, and that's how you're going to get the best healthcare. But the more
Absolutely.
you educate yourself from valid sources, I always
Yes.
caution you have
Absolutely.
to look at people that know what they're talking about. Not, every, barber can speak to if patient should be on GLP-1s. That's not. I'm not saying that they're not they could be the most intelligent person in the world. They just didn't go into the field. You got to be real careful and make sure that people have credentials and at least have an understanding of what they're saying.
Right.
However, you got to go, you have to just paint a broader brush and learn as much as you can. And then you can make really informed decisions and then also dispel some crazy stuff. Because just like in chiropractor, there's people, have complete misconceptions about spine surgery and, motives and all this other stuff. They don't understand just because your uncle said it at the barbecue. It doesn't mean that could mean nothing. That's an N of one. That doesn't
Exactly.
mean anything. That means
Exactly.
nothing. So anyway, it's been a pleasure talking to you today. This has been great. I think that the audience is going to just eat this one up. They're going to love it because it's great information. We're just talking. You're and the way you have a great way of getting your information out. If I was in Atlanta, I'd send my kids to you. Of
Oh,
course I
thank
would.
you.
I'd be like, yeah,
Thank
you
you.
gotta
You gotta go
go
see
see
her.
Dr. Holmes and.
Thank you.
Yeah, when we come down, when we visit, I'll bring the kids down for
Absolutely. We will do that.
for some adjustments and for some other things. And so, in conclusion, if people really want to, even whether they're in the Atlanta metro area or if they're anywhere, if they just want to learn more about you,
Mhm.
where can they go to learn more about you? I mean, is there a website you want them
Sure.
to go to? Is there social media? Tell us
Sure.
everything they need to know to get
Okay.
Dr.
Okay.
Candace Holmes.
Also, so I work with people throughout the whole nation, so you don't have to be in Georgia to work with me. I wanted to say that too. So
Yes.
I have my website, which is BrainCore of Duluth, core like an apple. And then I have Instagram with the same name, BrainCore of Duluth. And then if you would like to schedule a complimentary call to see, if you are a candidate for the therapy, it's bookwithdrh.com. And you can spell out doctor or DRH, it'll get you there. Bookwithdrh.com.
All right, sounds good. And then on the note, if you do stuff nationally in order to do the feedback, do you send them equipment
Absolutely.
to do the neurofeedback with?
Absolutely. Absolutely. I will contact my colleagues and my wellness affiliates as close to you as I can, and then I will ship the equipment out to you, and I monitor you remotely. Excuse me. Yep.
Oh, that's fantastic because neurofeedback it's a no-brainer. And again, we talked about all these. You mentioned it a little bit, but I just want the audience to know we talked about diseases. We talked about okay, this neuro thing, this, but for just normal people, just for athletic performance, for
Yes.
surgical performance, for
Yes.
performing in the boardroom, performing your tasks, whatever you do, neurofeedback is incredible. And I've talked to other neurofeedback experts, and some of the stories I hear about some of these like professional players and how like
Yes.
neurofeedback literally like they went from being not good to excellent, and they
Absolutely.
credit neurofeedback for that. And so I don't want everyone to come away from this say, oh, I'm okay, I don't need neurofeedback, my brain is working perfect. Exercise your brain, folks. Exercise your
Exactly.
brain.
I'll just say okay. I'll just say
Yeah,
okay.
that's what I do. I try to tell people stuff. You could bring a horse to water,
Can't
and
make them
then
drink.
it's like, well, on that note, it's been a pleasure having you, Dr. Holmes, on the show, and I'm definitely gonna love to have you back on the show because this was good. We got way more stuff to cover next time. I
Absolutely.
have all this. This has spurred all kinds of other ideas, and for our audience, thank you for watching and listening to another episode of Wellness at the Speed of Light podcast. What a great episode this was, and we'll see you on the next show.